Can I show you the improvements we've made to our mat strap to make it more streamlined and more effective at relief of tendonitis pain? Dr. Shapiro said immediately the Chopret style of strap is exactly the reason he was looking for a new strap. He had scoped a knee earlier in the day and his patient's patella tendon looked as if it was rope burned. The thin rubber tube of that Chopret style of strap was wearing out the tendon like a climber's rope rubbing and fraying over a rock cliff. He wanted a better brace, and John built it. The first thing we incorporated into the strap was a large shock-absorbing pad. A wider pad does not put such point pressure on the patellar tendon. It is comfortable to wear, and most importantly, an incredible shock absorber that Dr. Shapiro wanted to translate the shock created from jumping or running from the tendon to the structures around it. It is such a shock absorber that you can see in demonstration, if I hit my knuckles on the tabletop, that really hurts. But if I hit onto that shock absorbing pad, I can hit to a degree where you wouldn't want to do it on the table and yet feel absolutely nothing. That shows you how the shock absorbing pad disperses the shock into the muscle body. On the back of that pad is an aluminum bolster. This added piece of aluminum in the strap allows us to mold the splint or the strap to the patient to assist in focal point compression. The aluminum also lets us reduce the thickness of the foam pad, so the mat strap 2 offers a much more low profile fit to the patient. Over top of the pad, we've incorporated a material called Spectron. This is a non-slip material that prevents the brace from sliding on the patient's arm. The brace is universal. It reduces inventory needs where one size will fit all. Simply unhook the brace as you see it. We've actually cut this brace down for this demonstration and place it over top of a patient's arm. Wrap the strap around the arm and secure the fastening strap to the strap body itself. You'll see when we remove the strap that there will be residual material that we want to cut off. What we'll do is we will simply cut off the material that's beyond the D-ring. So at this point, we'll take our scissors and cut that material off. The brace is now perfectly sized for this patient. We'll slide the brace up onto the patient's arm, and then this secondary or counterforce strap has been positioned so that to apply pressure to the arm, we simply pull this over. The key to the function of the brace is this tightening strap. By tightening the strap down, we actually provide focal point compression, not a tourniquet effect on the arm, but focal point compression to relieve pain and provide comfort. The patient can simply adjust the amount of compression they want on their injury by pulling that strap tighter or loosening it. While we created initially an infrapatellar strap, even Dr. Shapiro says he uses it much more often for tennis elbow. As he says, tendonitis is tendonitis, whether it be patellar tendon or carpi radialis brevis. It is still a muscle and a tendon we have to protect. He was correct. The mat strap 2 works all over the body. How does this feel?